If you've ever been to the dentist, then very likely you're still being toxified by what they did to you. So in this video, I'm going to explain the damaging effects of the different dental materials used, including how they could potentially be causing you to gain weight. This is a Jade tooth project, and I'm on a mission to develop non-toxic dental restorations, and after watching this video, you will know why. Here's what the peer-reviewed science says. I'm going to start with the different materials commonly used, how they affect our systems, and later move into which restorations contain which toxins. So I'll start with BPA. BPA is widely used in different restoration materials, and it leaches out of these materials. It's an endocrine disruptor, and it outcompetes estrogen for binding sites. It also blocks androgen receptors. This reduces sperm motility in men, it alters egg development in women, and it can cause an increased risk of fatty liver, type 2 diabetes, obesity, insulin resistance, reduced hepatic glycogen storage, and non-alcoholic liver disease. So these are just some of the ways it can cause you to gain weight. It's also associated with higher levels of anxiety, depression, hyperactivity, and aggression in children. It causes an increased risk of hypertension and cardiovascular disease, as well as developmental issues. Now I'm going to move on to mercury, which is likely the most toxic thing being used by dentists today. It's been used in dental fillings for thousands of years, but it's a textbook neurotoxin. It damages the entire nervous system, including the brain, heart, and gut, which all contain neurons. The areas of the brain most affected are within the limbic system, which include the amygdala, hypothalamus, hippocampus, pineal gland, pituitary gland, and more. And this center is involved in emotion, behavior, long-term memory, sensory processing, motor skills, and attention. Mercury also directly toxifies the kidneys and is proven to cause developmental issues. And this is only scratching the surface of the harm that mercury poses. Mercury vaporizes at room temperature, so when it's contained in amalgam fillings, it actively off-gases constantly, and 80% of the inhaled vapor from mercury absorbs into the bloodstream. This can cause fluid accumulation in the lungs, respiratory irritation. It can cause tooth loss, gum inflammation, excessive salivation and sweating, high blood pressure, and high heart rate. It also gets trapped inside of cells in the brain and kidneys. So even if amalgam is removed, it can cause issues many years later because it stays stored in the cells. If you've heard of Mad Hatter syndrome, then you know some of the effects that mercury can have. Mad Hatter syndrome is based on the symptoms that hat makers in France and New Jersey historically would face because mercury was an ingredient in the solution that they would use to soften the felt on their hats, and this was inhaled by them. It causes tremors, anger, low self-confidence, shyness, apathy, memory loss, psychosis, hallucinations, and hair loss. And if you've seen Alice in Wonderland, well, the Mad Hatter is based off of this condition. Fluoride is another material widely used in dentistry. There's something called dental fluorosis, which is basically when the teeth start crumbling from excess fluoride. They say it's good for the teeth in small amounts, but how good can it be if too much of it makes the teeth fall apart? In excess, it can also cause skeletal fluorosis, which is characterized by brittle bones, calcified muscles and ligaments, and crippling deformities. Fluoride has been proven to lower IQ points by an average of 7. It's neurotoxic. It can displace iodine, causing thyroid issues, causing, again, weight gain, goiters, and depression. It also causes kidney issues, reproductive issues, nervous system issues, endocrine disruption, and developmental issues. Fluoride is widely contained in toothpastes, as well as added to tap water supplies, and salt is sometimes fortified with fluoride. Fluoride is naturally occurring in some water supplies, but the synthetic fluoride acts differently on our systems than natural fluoride does. Beyond this, nickel is widely used in dentistry, but nickel is an immune system irritant and a high prevalence allergen, so it can cause all sorts of respiratory symptoms, gastrointestinal distress, can cause headaches and other neurological symptoms. It can cause dermatitis. Interestingly, women are more sensitive to nickel than men, statistically. However, it's toxic to everyone. Ingesting 1 gram of nickel is a lethal dose. It can cause developmental and reproductive issues, and it can cause kidney and liver damage. Titanium is another metal used by dentists, but titanium can cross the intestinal barrier. It can decrease white blood cell and platelet count, which lowers immune system function. Titanium is cytotoxic and genotoxic, so it harms our cells and our DNA. Titanium can accumulate in the liver, spleen, lungs, and kidneys, and causes inflammation, tissue damage, and metabolic disorders. It can also cause developmental and reproductive toxicity. Microplastics are also caused by the different plastics used in dentistry, such as anything starting with poly or vinyl or acrylate or acrylic. Any of these words reference plastics. And microplastics have been detected in human blood, the lungs, placenta, breast milk, and arterial plaques. They're pretty ubiquitous. Most humans have some level of microplastics in their systems. Microplastics cause a 4.5-fold higher risk of non-fatal heart attack and stroke, and overall mortality, so death from any cause. They are associated with a higher risk of preterm birth, low birth weight, and neurodevelopmental impairment. Microplastics damage the sperm, ovaries, and cause endocrine disruption. They can also cross the blood-brain barrier, and on average, humans ingest 5 grams a week of plastics. That's about a credit card's worth of plastic every week. Microplastics can accumulate in the intestines, causing cytotoxicity and inflammatory bowel disease. They can also lead to flora or microbiome imbalance and liver toxicity. They're also genotoxic, affecting our DNA. They can host biofilms, so they're a vector for infectious disease and can increase the spread of infectious disease because bacteria can latch onto them. And now I'm going to move into the toxins that dental product materials are made of. Start with fillings. So amalgam is one type of filling. These are the silver-colored fillings. And these contain mercury. They're about 50% mercury by weight. Tin, palladium, indium, silver, and copper are also metals contained in these amalgam fillings. Composite fillings are the tooth-colored plastic fillings, and these contain BPA and methyl acrylates. Then glass ionomer cements are another form of fillings, and these can contain fluoride, aluminum, and acrylic. Inlays and onlays can contain aluminum, which is very similar to mercury in its effects, but also affects bone mineralization. Inlays and onlays can also contain titanium, lithium, BPA, and methyl acrylates. Flippers and retainers both contain methyl acrylates, cobalt, chromium, nickel, and titanium, all toxic elements. Braces contain everything I just mentioned for flippers and retainers, in addition to polyurethane, aluminum, and BPA. Dentures contain acrylics, cobalt, chromium, titanium, nylon, and in denture paste, there is petroleum and vinyl. Clear aligner systems contain polyurethane, polyester, BPA, and acrylics. Clear retainers contain polyethylene, phthalates, and polypropylene. Implants can contain titanium, aluminum, which is in zirconia, lithium, vanadium, BPA, acrylates, and PFAS from Teflon tape, which is sometimes used in implants, in addition to fluoride. Sealants can contain BPA, acrylates, fluoride. Crowns and bridges can contain nickel, chromium, cobalt, aluminum, lithium, and titanium. Veneers, the same as crowns or bridges, but can also be composite, which contains BPA and acrylates. Spacers can contain acrylics, nickel, chromium. Mouth guards for sports can contain vinyl acetate. Night guards are composed of acrylic. And that about covers it. That's what dentists are using, and they don't really offer anything else. So, a lot of people are suffering with mental and physical health symptoms as a result of these dental materials constantly leaching into their systems. But dentists generally tell people that these are completely safe. And that's just not true. A lot of people who experience these symptoms, they're either gaslit or misdiagnosed and treated with some pharmaceutical prescription, which may mask the symptoms, may not, but either way it's not getting to the root cause. A lot of alternative practitioners will recommend things like herbs or meditation or affirmation, but while these things are generally healthy, they also don't get to the root cause. No amount of affirmations will take these toxins out of someone's system or someone's mouth. So, if someone tells you that the symptoms you're experiencing are all in your head, you can tell them they're absolutely right. They are in your head, in your mouth specifically. And it's not just imagined, these are real symptoms. And nothing can be done to solve these persistent issues other than removing the root cause. So if you have persistent illness with mysterious origins, hopefully this gives you some answers and can steer you in the right direction to reclaiming your health. I'm not a doctor, I'm not a medical practitioner. What I'm saying here should not be taken as medical advice. And I'm not liable if you choose to act on this information or if you are harmed as a result of doing so. But this whole channel is about informing people, giving educational material and the scientific truth for people to understand what has been done to them and to try to develop new solutions. I created this channel because my fiance and I need certain dental restorations, and we don't want to turn to the dental industry because we're privy to what they offer, and we've been hurt in the past by these things. We're actively healing from them now. But nonetheless, we need real solutions. We still need dental work. And a lot of things can be taken into our own hands. And this is one of them. However, we're still in need of support, trying to build a team, trying to connect with people who are knowledgeable in this area or passionate in this area, such as people who do have experience in the dental industry but would like to rebel against the system, someone who has access to, for example, a 5-axle dental mill with diamond fittings, a diamond burr for the crafting of nephrite jade to be used for inlays or flippers. This could also be done by a CNC engraver, like the type that are used to craft gemstones and shape gems. So anyone with access to those kind of tools, I'd love to connect. People who know how to interpret CBCT scans, and anyone who has experience as a patent attorney or a clerk would also be very valuable, because if this works, if we test a prototype on ourselves and we're happy with it, then we would love to share this information with the world, make it accessible, and prevent the patenting of these new technologies so that they can be affordable and made by anyone and accessible to anyone who needs them, so they can't be corrupted or co-opted for profit by the dental industry or anyone else. If you're with me, please join me. I'd love to hear from you in the comments section or by email, which is linked to my YouTube page. If you'd like to support this channel, please like this video, subscribe and watch my other videos, and please share this video with anyone who you think may benefit from the information, your friends or family. And please stay tuned for more. Thank you for your time.